Hello everyone, my name is Cameron and I have gathered the officials of the Doctor of Physical Therapy programs to discuss the issue of clinical empathy in physical therapy and proposing a solution. Overview. What is clinical empathy? Clinical empathy is a skill of understanding how a patient feels and then effectively communicating that understanding to the patient. Why is clinical empathy important? Clinical empathy in physical therapy is very important because patients seek their therapists to show them an empathetic attitude in a clinical setting daily because it improves their recovery process and contributes to a happier patient and therapist. What is the issue in the physical therapy career field? Physical therapy is a career field that requires a doctorate degree, meaning about 7 years of school, and it is proven that throughout school, therapists' empathetic attitudes begin to decrease, which we'll talk about in a minute. This is becoming a bigger and bigger problem because an empathetic attitude is one of the most important skills that a physical therapist should possess. So what are the facts and what are the statistics on therapists' empathetic attitudes? So this is a graph that shows the mean empathy scores of students throughout their years of school. And as you can tell, during their first years of school, empathy scores were up, but they gradually began to decrease each year. Whereas therapists should end their years of school with a very high empathy score rather than a low score. Basically, to improve the career field of physical therapy, we want to flip this data. So, what are the previous solutions and what has already been tried to fix this issue? Although only some realize the severity of the lack of clinical empathy, Doctorate of Physical Therapy programs do use patient interaction videos to display clinical empathy. However, these do not have a long-term effect nor only focus on clinical empathy. So, what is the proposition? I am proposing a solution that will enhance patient interaction videos to make a more long-term solution. The goal of my proposition is to introduce the issue to future therapists by creating a required course in the Doctorate of Physical Therapy program that is solely focused on clinical empathy, which will ultimately strengthen physical therapists' empathetic attitudes, leading to better well-being and better recoveries for the patients. So what are the steps? There are a few vital steps in creating this course. The first step obviously being creating a course only focused on empathy in a clinical setting and adding it to the Doctor of Physical Therapy program curriculum. Next is to make this course a requirement in the program for a student to obtain their doctorate degree. The next step being to introduce the problem and teach students exactly how to show the needed empathetic attitude toward their patients and the importance of clinical empathy. Also, practicing an empathetic attitude in a clinical setting is vital to effectively teaching clinical empathy. So, practicing on real patients and even like dummies will help to ultimately strengthen their empathetic attitudes and understand how important that can be. And then the final step is to test out of the course. So, by passing a test, it will show that the patient has proven that they are ready to show clinical empathy on a daily basis in their clinics, and they know the importance, like how important clinical empathy really can be. So the solution, by creating a course and making it a requirement that's solely focused on just clinical empathy, promotes healthier recoveries for patients, and will enhance the short-term solution of patient interaction videos by only focusing on clinical empathy and teaching the severity of the issue and what they can do to fix it. It will also encourage therapists to strengthen their empathetic attitudes and improves patient recovery and well-being. So for me, I believe that if a patient is not receiving the empathetic attitude from their therapist that is needed, it will delay their recovery process, which can push them back. But having a therapist with a strengthened empathetic attitude can improve the patient's recovery and well-being altogether. So, feasibility. Creating a course and adding it to the curriculum of Doctorate of Physical Therapy programs will cost money. So with this being said, increasing student tuition for Doctorate of Physical Therapy school can be important to provide what is needed to make this work. Instructors for this course are necessary, as well as textbooks, to serve as a resource for students to learn effectively. And increasing student tuition can be risky, but the outcomes from creating this course will outweigh the few hundreds of dollars for the course. It will lead to yourself and your loved ones to have a more healthier recovery process in physical therapy and a better well-being altogether, as I had stated previously. So, really, how important is creating this clinical empathy course? Creating this course is very crucial in the making the field of physical therapy effective. So what can you do? You can realize the severity of this issue and how important it can be, and begin taking the steps to adding this vital course to your curriculum to make the field of physical therapy a better place. How will it ultimately affect all of us? This will affect all of us because physical therapy is the only way for our loved ones to overcome an illness or injury, meaning that if physical therapists begin to realize the importance of possessing an empathetic attitude, then it will ultimately lead to healthier patients altogether, including us. Is it worth it? I believe that this solution, and I believe that you will believe it too, this solution is by far 100% worth the work, being as it will most definitely strengthen the empathetic attitudes of our patients who are important people in our lives and in the field as a whole. Thank you, and I hope you all have a great evening.